Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, what are the CSF abnormalities? What are the CSF abnormalities that we see in bacterial meningitis? In bacterial meningitis, the opening pressure of CSF is more than or equal to 180 millimeters of water in bacterial meningitis, and the CSF or serum glucose levels in the bacterial meningitis. CSF by serum glucose levels is found to be 0.4 in bacterial meningitis. If you see, the latex agglutination test in bacterial meningitis is positive if the meningitis is due to streptococcus pneumonia. If the meningitis is due to streptococcus pneumonia, then latex agglutination will be positive. Then we have one more test, limulus lysate test. Limulus lysate test will also be positive if the meningitis is due to gram negative organisms, which is gram negative meningitis will show limulus lysate test positive. If you do a PCR, this PCR will mainly detect the bacterial DNA. Then you can also do a gram stain. If you do gram stain, it will be positive in more than 60% of the cases. It is positive for more than 60% of cases. Gram staining. Then if you do a culture, you can do culture which is found to be positive in more than 80% of the cases. Culture is positive. Okay. Now, if you were asked what is the most accurate test for bacterial meningitis, CSF culture and sensitivity. This CSF culture and sensitivity is most accurate. It is actually the most accurate test to diagnose the bacterial meningitis. Why? There is one more test to diagnose bacterial meningitis, which is gram staining of CSF. But this gram staining of CSF has poor sensitivity, but it has good specificity. Though it has good specificity of around 50 to 60%, because of its less sensitivity, mainly the gram CSF culture and sensitivity is the accurate test for diagnosing bacterial meningitis.
thank you and thank you for watching.